Hello and welcome to Visible Voices. The Visible Project is a Leeds-based initiative aimed at improving the outcomes of adults that have experienced any form of child sexual abuse. The Visible Project is made up of two equally important groups. The Strategic Steering Group, which consists of both statutory and voluntary organisations within Leeds, and the Visible Leadership Reference Group. This podcast is by Visible Leadership Reference Group that consists of people who have experienced any form of child sexual abuse, otherwise known as CSA survivors. Names may or may not be used throughout this series. In this episode, we will be speaking with the Visible Reference Group about experiences of accessing healthcare and dealing with health professionals. This discussion includes examples of best practice.
So, can you tell me of a bad experience in a health setting?
That I've experienced, yes. And I'm not saying it as a criticism and say it's all the other person's fault. I think it's my reaction to things and also how the other person might not really understand where I'm coming from. I can come across, in some situations, I can come across as quite awkward or stubborn or uncooperative. A recent one I had is I was ill and I had to go to A&E. And I was in A&E for 9 hours on a stretcher in a side room, and I needed to go to the toilet. I needed a wee. And so I asked the assistant auxiliary if she would help me go to the toilet. She came with bedpan and attempted to grab me and open my legs. Well, I just burst out crying and said, leave me alone, and was crying, don't touch me, don't touch me. So that could have been quite confusing for her because I was saying, I want a wee, but then when she was trying to help me, I was just crying and asking her to leave me alone. So I can see how my response to her could have come across as, well, you're being awkward. What's wrong with you now? But I had previously said to her, I don't like being touched. I didn't have the confidence to say why, but I said, I don't like being touched and I don't like being exposed.
So you made it clear in advance what your boundaries were, and she had overstepped your boundary.
Yeah, she'd not understood the importance it was to me that I'd said, I don't like being exposed and I don't like being touched. And I said that all the way through my admission to anybody that came in when they were doing the blood pressure, when they were doing an ECG. I was like, I don't want to be exposed. And so it was the same person. So she didn't understand how important it was to me that I wasn't touched or wasn't exposed. And my response to her was I didn't expect to behave like that. It was just an automatic thing. When she went to grab my leg, it re-triggered something. And I just started crying, please leave me alone, don't touch me, don't touch me. So I can see how in that situation I might have come across as being a little bit awkward, but I wasn't. I was just reliving trauma.
Of course, yeah. What happened after that?
She just left me.
Yeah. She left you. Did another healthcare professional come in?
No. I was in a side room with a door. There was no windows or nothing. I felt quite vulnerable in there. I was on a bed. I had pains in my head. They thought I was having a bleed. I had pains in my head. I couldn't see because I was photosensitive, light sensitive, or whatever it's called. And I was sick and dizzy, so I was lying down just with my arm covering my eyes. But I felt quite vulnerable. One, because I wasn't well and I knew I couldn't run away. I didn't feel safe. But I was in this not locked, but a room with a closed door with no windows or anything. I felt quite vulnerable being there. And then when she came in to do my blood pressure, and I said, I need a wee. And then she came back with a bedpan. And then when I started crying, leave me alone, that's what she did. She just went, oh, all right then, and then left and closed the door again. So for me, that was a really bad experience and really quite upsetting. Whereas I'm thinking that she might just think, well, she was bloody awkward.
Yeah. But in truth, it was the experience of child sexual abuse was re-triggering you and making you present like that. And do you think she was aware of that?
No, I'd said right at the beginning, and like I say, all the way through it, that the much that I'd got, I were able to say that I'd experienced trauma as a child. I don't like being exposed. I don't like being touched. And I'd repeated that over and over and over again when any doctor came in. I don't like being touched. And I said childhood trauma.
Mm-hmm.
I think I might have said CSA because that's as far as I can go, assuming that they'd know what that acronym meant. Nobody said, what do you mean by that? So I'm presuming that they knew what child sexual abuse, CSA, was. But I felt that it wasn't acknowledged. They were there to do a job. It was accident and emergency. We're treating you as an emergency, so this is what we do. That's what it felt like.
So it's very difficult, isn't it, sometimes to know, to actually be able to say the words. You don't really want to say it in the middle of where there's lots of other patients. You don't want to say, I am a survivor of child sexual abuse. It's a very difficult sentence to say that.
Mm-hmm.
And that's obviously the hidden issues that are around child sexual abuse, is that it's very difficult to say to people, this is what I've experienced and this is still impacting on me today.
Yeah.
And unfortunately, we have to sort of navigate around it without making ourselves feel that we're vulnerable or over vulnerable or exposed. That's a very difficult situation.
And I think in some ways the way that I present myself can be very contradictory. In some situations, I'm a very compliant person, but that's come because of my experience when I was younger and the abuse. I can be very compliant. I won't say boo to a goose. I will go along with anything, even though I don't agree with it and that kind of thing. So in some ways, I can come across as very polite, very compliant, very cooperative and that kind of thing. But then there's certain things about being touched or exposed that I can be very, very stubborn. I'm using words negative, but because that's what I envisage that people will think of me. But I'm not. I'm protecting myself. That child is having to protect. I'm still that child in a lot of ways. So I'm having to protect myself and I won't expose my body and that kind of thing.
Yeah.
So it can be quite contradictory.
Yeah. And falling is a word that's not fully discussed in our society. Masking and fawning, it's probably something that potentially people with autism might be familiar with. But fawning is exactly how you've described there. It's like a pretending that everything's all right. It's like the fight, flight, freeze plot, and it's the friend one. So you're trying to be over nice and overcompensate for the fact that you're absolutely in fear inside. It's a bit like the idea of a duck paddling really fast underwater and floating gracefully across the surface, sort of thing. And in child sexual abuse, correct me if I'm wrong, but we have to fawn a lot.
Yes.
And it becomes a common issue.
Yeah. One, I can think that's what you're saying there's made me think of a couple of things. I remember once being in hospital and the consultant psychiatrist saying, excuse my language, but you're a fucking good actress.
Yeah.
Because people wouldn't have a clue of my difficulties because I can be so compliant and so appropriate. But then that can have a different response because not that long ago, I needed to see my GP. And there's only one GP that I will go to that I like, that I feel safe with, who knows my history. But I couldn't get in to see that one. So I had to see somebody different. And I was saying on the phone how anxious I was and how uncomfortable I was because I only wanted to see this certain GP that I couldn't. So that doctor that I was seeing knew all those things. Not once in that consultation did they ask how I felt during that consultation. And I was very compliant and very polite. I let them do my blood pressure because that's fine. I asked all the questions and behaved appropriately. When I read my notes that were online, it said, that I was anxious and apprehensive about the meeting, but we got on well. So there was an assumption that because I was compliant, I was okay. I was absolutely screaming and panicking inside because I was with this new man in a consulting room that I didn't want to be there, doing as I was told, being polite and not wanting to rock the boat or anything like that. And that interpretation by that doctor had been that we'd got on well.
What would you have written if you were that GP and you were writing in the notes?
Well, before I was writing the notes, I would ask that person, how are you feeling? Or even acknowledge, I know that you don't want to see me and you normally see Dr. So-and-so. That acknowledgement, yes, he can't magic the other doctor being free. I don't expect to have everything my own way all the time, but he could have acknowledged, I know you said that you're quite frightened about seeing another doctor, particularly a male, in a consulting room with door closed and no windows. How are you feeling? There was none of that. Just because I was polite and did as I was told.
Yeah.
And acted. On my notes, it says we got on well. But I was absolutely petrified.
Yeah.
So I think there's so many assumptions instead of just asking. I think that's what I want tattooed on my forehead. Don't assume, just ask me. I do, because I think it's just as simple as that.
I'm in total agreement.
All this trauma-informed care and stuff like that, to me, it's nothing. Just treat somebody as an individual and ask them how they're feeling and what they want. And I think that is a really good starting place. It's not being knowing everything or being critical, or I think a lot of the difficulties and a lot of re-traumering for people who have experienced child sexual abuse can be reduced by just asking questions and asking if people are okay with it. And also the experience of staff that it's a difficult patient, they're oppositional, they're uncooperative. Why are they behaving like that? Instead of just assuming that's what they are, think about or ask them, why are you being like this? Why are you being quite defensive? I think there's too many assumptions and not enough asking.
Yes, I agree.
How do you appear in care settings or in an environment, health setting or whatever? Are you compliant? How do you respond? Do you kick off? Are you quite a yes person? How would you respond?
Good question. How would I respond? I had an experience recently where I went into a hospital for a minor gynecological operation, and it was just a cyst on my ovary, and they had to check while they were near my cervix. They went into the womb and pulled.
I'll pick up on that. I think for anybody who's experienced CSA, a gynecological problem is not minor because it's in that area that holds so many emotions and memories and experiences. I don't think anything can be minor.
Thank you. Yes. And thank you for that acknowledgement. You are right. It wasn't minor. It's in general terms of operations severity. It's
but again,
minor.
That's an assumption, not seeing you as an individual.
Very true. Very true. And that is a really good point. Thank you. But what I did find with the whole process, and I'm not complaining about the service provider directly, it's all about the humans who were working in that team, in that environment. But after the surgery, initially before, I raised it and I mentioned that I was a child sexual abuse survivor, and that obviously the impact of the operation that was going to happen, because it was gynecological, and also the fact that I'm putting my trust in other people to touch and help me with my body in whatever way.
Did you have a general anaesthetic?
I had a general anaesthetic.
So that must have been, I can envisage, that must have been frightening, or it would be to me knowing I'm not aware of what people are doing to me and my body.
The strange thing is, I had already foreseen it because I'd heard your situations and other people's invisible situations, all our members explain situations in hospital environments where they had had bad experiences, just how you've explained. So I was prepared for it, But the weird thing was I hadn't realised what the impact would be to me. I thought, yeah, I'm fine. So I skated into that setting with the anaesthetist, putting me to sleep. Absolutely fine. Describing the operation beforehand and the pre-assessment. I'd explained that I was CSA there. The information hadn't been passed on, but I didn't feel out of control or vulnerable or scared as I was going under. It was when I came out, I was wet underneath from the operation, but waking up wet was a trigger, taking me back to times, when you're a child, when I was a child, that I didn't want to actually remember. So that was traumatic in itself. The fact that you're coming out of anaesthetic and you're not 100% compos mentis anyway, and your head's off with the fairies, having a little wonder about. So the fact that I would, in a way, have been drugged, and that was a trigger as well. And also a trigger of the child sexual abuse. But what else was a trigger was that when I went to explain myself, for example, saying, I'm wet, I'm confused, this is really scaring me. I told them that I was a CSA survivor and, can you not understand how I'm feeling right now? There was no sort of level of empathy. And practically, so I was wheeled out of one room into another. I suppose my expectation or my wish would have been a comforting matron type person who would gently reassure me that I was okay and remind me where I was and that everything was all right and we're here now, sort of thing. Just to reassure,
make sure that you're safe, and those are just memories not happening now.
Absolutely, just to reassure me, but not patronise me. Just to bring me back into the present. However, what happened was I was wheeled into another room, and then I think she was a ward sister. Again, I was still a bit hazy from the anaesthetic, but I'd come round enough to be panicked, and she wanted to know what my complaint was. And she leant over my bed with another nurse, and they were both very intent on asking me at that point, which I thought was a really inappropriate time to ask immediately after the operation. I think they could have waited half an hour till I come round a bit further as to what they could do and how they could do it better. And I just think then was not the right time for the feedback that I needed to give.
Yeah. And I'm thinking, just from hearing you, I would think that conversation happens before you go in, so that they knew how to support you. From what I'm hearing, you were treated as an object rather than a person. It was like a conveyor belt. You're having this, we tell you this, this is it. Right, you're in, you're out.
You're right.
You're treated like an object, which is what somebody who's experienced CSA feels like and was used like as a child. They were an object for somebody else to use. And that pattern is being repeated in that situation. I would have liked to hear from you that before you had the operation, you had those discussions about when you're coming round, you might feel like, and prepare you and have that dialogue. There seems to be no dialogue anymore or no conversations.
It's very quick. And I don't know how many people they had in that gynecological surgery that day. And I don't know how rapid, but I did feel the pace was too quick. My processing speed is not very fast sometimes, particularly when I'm vulnerable, because your brain freezes to protect and control itself. And all of these things were discussed in my pre-assessment that was 2 weeks before over the phone. However, the information from that I shared there, although the lovely lady on the phone was really empathic and reassured me, and I'm sure she wrote it all in her notes, but that didn't seem to have been passed on. Again, there was no acknowledgement. It's just this sort of shameful word of child sexual abuse. And we can't mention it. We can't raise it.
Yeah, and it sounds like you had to say it so many times, repeatedly, to different people and to the same people over and over again, sort of explaining your behaviour. And you shouldn't have to explain.
In a gynecological surgery ward, which could be a trigger for any lady.
Yeah.
Let alone someone who has been a survivor of child sexual abuse. Yes.
Yeah.
So, I'm in the process of writing to the hospital to maybe or potentially offer them some visible training that we're doing.
Yeah.
Just so that they can make sure nurses understand that.
Or feel that don't be frightened to ask the question.
Absolutely.
Like, I know it's in your notes that you've experienced this as a child. Is there any support you need with it now? I know this procedure's involving that area. You don't even have to be specific. You can just be like, leave it open. Is there anything you want me to explain about afterwards?
Yeah.
How are you feeling? Just that.
We don't have to say the CSA acronym or the word once we've said it once. That should be the protocol, really.
Yeah. And it's not just with us. They should have that with everybody.
Yeah.
Treating everybody as an individual rather than an object.
Yeah. And unfortunately, some do, some don't. So those were our bad experiences. May I ask you what your good, or do you have a good experience, firstly?
I think that's a good question to ask, because it will sound negative, but a lot of my experiences have been negative. I felt them as negative and quite damaging, just from what people have said to me or how people have referred to me, quite dismissive and not taken seriously and that kind of thing, which when you don't take yourself seriously, somebody else colluding with that just adds to it. I know, and you weren't that important and that kind of thing. I don't want to use the word positive, because I don't think any interaction or medical thing is it is positive. But I felt the experience that I can give where I felt I was treated as an individual with respect was urology, when I was seen by urology, because one of the issues that a lot of people have, not everybody, but a lot of people who have experienced CSA have issues with their bladder or their waterworks or that kind of thing. And there's been research to say that it's a common thing. I never mentioned anything for a lot of years about my bladder problems. But then when I did, I got referred to urology. And I made it very, very clear right from the beginning. I couldn't say nothing about my history was passed on from my GP. Just a referral to urology was made. And my first appointment, I wrote it down I couldn't verbalise it then. I wrote it down on a piece of paper and gave it to the doctor that I saw and said, I can't be touched and I don't want anybody touching me, or I don't want to be exposed. If you want to discharge me and not see me and not help me, that's absolutely fine, because I know, but I can't go there with that. And they were lovely. She was like, we'll work around it.
Lovely.
And I never had to mention it again on subsequent appointments. And they respected what I said. They didn't try and talk me round. They didn't try and put things on me. They didn't try and make me feel guilty that I was wasting their time, or that I wanted things done special. They didn't make me feel like that at all. I got referred onto a surgeon then for an operation. Again, I didn't have to say anything to him. They'd passed on that information. So it was nice me knowing that he knew, but without me having to say it. So I felt quite safe. And again, he never made me feel that I was being awkward or anything. And I needed an operation, and he was the one going to do it. And no matter how many times I asked him, can I keep my underwear on in theatre? He just went, yes, you can. He didn't go, I've answered that 3 times, or he didn't make me feel that I was asking the same question over again. My impression was he understood that that was important to me. And no matter how many times I asked it, he said, yes, you can. Yes, you can. And just reassured me, which that's why I wasn't bothered about the operation. I couldn't care less what anybody's doing to me, but I still not want to take my underwear off.
So what I'm hearing is the way he responded, it wasn't patronising.
No.
It was agreement. He wasn't rolling his eyes or making it out that you'd repeated yourself several times. He totally understood the situation. Do you think his response is because that department is used, or it's more common that child sexual abuse victims access that surgery?
Yes, I wasn't aware of how prevalent bladder and urology issues are. I'd never connected it to what happened when I was little, but it is. So yes, in that department, he's had experience, and he did say to me, a lot of people who are having this procedure have had your experience. So he's familiar about working with people who have experienced CSA. But we're all different. Just because you've experienced CSA doesn't mean to say you're going to behave this, this and this. Somebody else might not be bothered about wearing their underwear, but might be bothered about something else. But he accepted what I said, didn't challenge it, didn't make me feel stupid, didn't make me feel as if I was being awkward or anything. He would just reassure me, yes, you can.
Yeah. Your experience that you had with that healthcare professional was really positive, but also he gave you some information that's, I think, quite valuable personally, that other people, other survivors of child sexual abuse have had this operation in the past. And that's quite a powerful statement. So I don't know how, that's how I feel anyway, when you mention that. And a relief that you don't feel, it doesn't normalise what's occurred to you, but it makes you feel like you're in safe hands.
Yeah, it made me feel a couple of things, actually. And again, they were quite contradictory. That, one, it made me think, oh, goodness, somewhere else that it's affected. It's affected every area of my life. There's nothing in my life where being sexually abused has not impacted or touched on or influenced. It was like something else, what it's damaged on, it's ruined and that kind of thing. So there was that level of thinking. And then it made me think, oh, it's not just something that's wrong with me. It's a response to what my body's been through. And it led to a dialogue, a visible meeting where there was maybe about 5 or 6 of us. And I was talking about going for my operation and this and it turned out that every one of us in that room had issues with his bladder. And it was like, right. One, this is really common impact from experienced child sexual abuse, and a bit of an, oh gosh, yeah, it's for me, it doesn't just affect your mind, it affects your body. And it led me to think and understand more about that being sexually abused and I was a young child when I was developing, not just affected my personality and how I respond to things and how I see myself and how I see the world and my reaction into it. It actually affected my physical development as well. And I think that was my first understanding and exploration of that side, where I always just thought it just affected me mentally.
Or it's just a health issue that's come to me. Yeah.
I always thought that what happened when I was little, which is how I call it, had just affected me, how I am with people and that kind of thing. It brought it all together, that abuse, particularly in a developing child, when the body's developing, that child sexual abuse can affect both physically and psychologically. And I think in some situations, people don't understand that. I know I didn't, and I was somebody who had experienced it. But I think as well is in the healthcare settings, we tend to see physical and mental health separate, where actually they're intermingled when you've got a history of trauma in childhood. And I think sometimes that isn't put together by some. Yeah, I think it's not, and I don't want to sound patronizing, it's not rocket science. It's not all these, let's have a legislation for trauma-informed care, trauma-informed practice, let's do this, let's have this policy. To me, it's not like that. It's about treating somebody holistically, so the body and the mind together, treating them as an individual, not say, oh, just because you've experienced CSA, you will behave like this. It's about seeing somebody as an individual, seeing them as a whole, and don't assume, just ask.
Just ask.
Yeah, I tell you, I'm going to get it tattooed on my forehead. Don't assume, just ask. That's all I'm asking from a health care professional. I'm not expecting them to know everything, to do everything right, but just ask and work with me and be willing to listen to me.
And that could apply to any person, couldn't it?
Yeah.
Who's in a situation, because none of us know what any traumas we've been through. Don't assume, just ask.
Yeah.
Thank you to our members for that discussion, and thank you all for listening to Visible Voices. Please join us again next time. Toodle pip. Thank you for listening to this episode. We hope you found Visible Voices interesting, thought-provoking and helpful. Visible Voices was created and delivered by the Visible Leadership Reference Group. Special thanks to all those that contributed today. Western Studios Leeds Limited for facilitating the podcast. The music was produced by Mark Parvin, aka Marvin Parks. To find out more about the Visible Project, go to visibleproject.org.uk. You can also follow us on Twitter and Facebook. If the content of this has affected you and you live in Leeds, please go to the child abuse subsection of the Mindwell website, mindwell-leeds.org.uk.